body composition and cancer. In this video, you will discover some exciting new understandings of how elevated fat promotes cancer and it reduces survival after treatment, and how the loss of muscle is also related to cancer, and how the body mass index scale may miss this important connection, and why it's vital for you to understand it. This will help empower you so you can take control of your health to optimize and reduce your risk to cancers as much as possible. The interaction of diet and lifestyle on cancer promotion and reversal. This time we're looking at body composition and the body mass index and seeing how it fits into this whole circle of cancer promotion and reversal. Body composition and health. This diagram will help explain what the loss of muscle, sarcopenia, is and why many people, when they lose muscle, they actually gain fat to replace it. The person in the middle has gained some fat and proactively she has decided to lose some weight. On the left you can see she's lost weight and in a healthy manner. On the left hand side she looks good and the scale says she's lost weight. Unfortunately, it's an unhealthy weight loss. What's the difference? On the left you can see when she has lost weight, she has preserved muscle. That's the red tissue. And she has lost the yellow tissue, that's fat. So she's preserved her muscle and lost fat. On the other side, on the right hand side, you can see there's less red tissue, there's less muscle, and there's more yellow tissue, which is the fatty tissue. So in both times, this person has lost weight, and both times the scale said she lost weight. However, on the one side, she preserved her muscle and lost fat, and that does wonders to enhance her physiology and reduce her risk of cancer. On the other side, she's lost weight and she does look good and the scale says she lost weight. However, it's an unhealthy weight loss. She has lost muscle and gained fat. And this contributes to things like high blood pressure, high cholesterol, insulin resistance, and puts her on the road to type 2 diabetes. This important paper from 2011 entitled Associations of Insulin Resistance and Adiponectin with the Mortality in Women with Breast Cancer. Adiponectin is a molecule produced by your fat tissue, by the way. And what did they state? Overweight or obese breast cancer patients have a worse prognosis compared with normal weight patients. Going way back to 1996, this paper entitled Clinical Detection of Sarcopenic Obesity by Bioelectrical Impedance Analysis. This was published in the American Journal of Clinical Nutrition. And sarcopenic obesity is the loss of muscle and then it's being replaced by fat. What they stated was, in perimenopausal women at increased risk for breast cancer, the BIA showed a high prevalence of sarcopenic obesity, 28 out of the 30 people tested in these women who had normal body mass index. So if you just use your height weight scale, the body mass index, you may be missing this loss of muscle and the replacement of it with fat. So the body mass index misses sarcopenic obesity. Paper was very important because they stated that weight gain in terms of fat decreases the rate of survival in breast cancer patients after chemotherapy. Thus, if a patient has gone through chemotherapy and if they gain weight in the terms of fat, it decreases the rate of survival. And these patients should be counseled to lose weight the right way. In this current paper, the author stated the positive association between obesity and postmenopausal breast cancer has been attributed in part to the fact that estrogen, which is a risk factor for breast cancer, is synthesized in adipose tissue. Obesity is also associated with high levels of insulin, which is a known mitogen. Insulin causes cells to grow and divide. Insulin is a powerful anabolic hormone. Again, another very current paper from 2011 stated, obesity increases the risk for type 2 diabetes cardiovascular disease, and cancer, for example, colon cancer. And 2, it is generally accepted that metabolic changes associated with overweight and obesity, particularly the abdominal obesity, that's the belly fat, and changes in the fat cell function contribute to the increased risk of colon cancer. This was from a paper entitled Obesity-Related Colon Cancer, Dietary Factors and Their Mechanism of Anti-Cancer Action. In this paper, they stated, and their conclusion was, given that elements of body size and composition are positively associated with breast cancer risk, it is possible that women could reduce the risk by maintaining ideal body weight after menopause. In an interesting study entitled Prevalence and Determinant Factors of Sarcopenia in Patients with Type 2 Diabetes, this was from the Korean Sarcopenic Obesity Study, their conclusion: Type 2 diabetes was associated with increased risk of sarcopenia. These characteristics may contribute to the physical disability and metabolic disorders in older adults with diabetes. To kind of summarize this, with type 2 diabetes, often people lose muscle. And muscle is where that uses most of the metabolic fuels, such as glucose. If you lose muscle, you tend to develop more insulin resistance, and it accelerates you on the road to type 2 diabetes. Yet another paper entitled Sarcopenic Obesity, a new category of obesity in the elderly. A few of their statements included, recent data suggest that peptides produced by adipose tissue may play an important role in the pathophysiology of sarcopenic obesity. What does that mean? That there are molecules produced by the fat cell that contribute to the loss of muscle through inflammation. And identifying elderly subjects with sarcopenic obesity should be mandatory. Yet another current paper, the quantification of lean tissue losses during cancer and HIV infections AIDS. They stated the emergence of the concept of sarcopenic obesity in cancer patients, a condition associated with decreased survival, demonstrates the necessity to access their body composition with easily available methods such as bioelectrical impedance analysis. This is a simple in-office test, and it's usually very inexpensive. And this paper stated, our studies suggest that bioelectrical impedance phase angle is a potential nutritional indicator in advanced colorectal cancer. And further research is needed for better nutritional evaluation and management. There are many papers suggest that using BIA testing to monitor and enhance nutritional protocols help build up clients' health, and it's a best practice and improves outcomes. And it's a simple, fast test. So BIA testing helps get better outcomes. So this connection between cancer patients and obesity and type 2 diabetes. Elevated insulin promotes belly fat, and belly fat in turn increases inflammation in the body. And we know that inflammation promotes and increases cancers. So insulin and inflammation are playing an important role in cancer development. So as a summary from this video, obesity, specifically gaining fat and the loss of muscle, called sarcopenia, are related to increased risk of cancers, reduced outcomes after treatments, and poorer prognosis. The body mass index scale misses muscle loss. And having a body composition test can help evaluate where you're at in terms of your fat and muscle, and it helps to monitor your nutritional status, and it helps clinicians develop a program that works. So having a body composition test can help evaluate where you're at and help to monitor your nutritional status. It's a best practice. In the next video, You'll explore how insulin contributes to cancer and some exciting new findings on this. This will help you better address the root cause of cancer and chronic diseases. As cancer affects so many families and friends, please forward this educational video onto them. Thank you.